We have been presenting daily 24-hour reports. If we look at our curve, we are beginning to see that the numbers are beginning to rise. We are no longer on that steady incline. We seem to be taking a curve and moving up this. And we do expect that at some point we will have to hit our inflection point, move up quickly and reach some peak and then come down. So we believe that this may be the beginnings of our inflection point where we are rising. So in terms of trends of infection, we expect that we may see rising numbers. Why are we also seeing rising numbers? Well, yes, containment measures have been in place, but you will agree with me also that adherence to containment measures have also somewhat waned over the past several weeks. You know, we are all human beings, I know, and we do feel that at some point a lot of these constraints, people may want to get away from some of these constraints. We're beginning to see this, and that is why every day when we come up onto this podium, we appeal to fellow Kenyans that we cannot slacken on this. If we slacken, if we begin to fill up our matatus without any respect to the distancing measures that we have put in place, if we begin to congregate and meet in places, we will certainly see an increase in numbers. You all know the examples of countries that have managed to contain this virus, almost contain it, and then suddenly they relax some of the conditions, open up worship houses, or remove some of these measures, and we suddenly see an increase in the number of infections. This infection is transmitted from person to person through contact of surfaces that are touched, and therefore it needs that mode of interaction to be able to be transmitted. The containment measures work on breaking that mode of transmission by preventing one person passing on the virus to another person. The masks do that, the distancing does that, the physical distancing do that, the hygiene measures do that. They break that cycle of transmission. So we should not relent on breaking that cycle of transmission. That's the only way that we can control this virus. Eventually this virus, the curve will rise, but these containment measures will allow us to be able to manage how this curve rises such that it does not overwhelm our health systems. I think that is the entire strategy of the response against this virus right now. There was also a question on the dexamethasone. It's called dexamethasone. It's a steroid, commonly used steroid actually, for anti-inflammatory conditions, widely available and quite a cheap drug. Yes, indeed, there are some findings of limited clinical trials that report some level of impact of this drug when given to COVID-19 patients, especially those who require either additional to be provided with support in respiration. It's an exciting finding that most of the countries are now looking at, and it comes on the heels of dubious findings regarding the other proposed therapy for this condition, that is the chloroquine azithromycin mix. So I think everyone is excited about this and needs to know whether it indeed works. What I can say is that this is a limited study. It had a limited number of patients that were looked at, but clearly among those limited number of patients, there seemed to be some level of improvement when given this drug. So I anticipate that in the coming days we will see many more large-scale trials that will explore this particular drug further. The WHO-sponsored Solidarity trials, which was looking at about 4 arms, I'm sure will now be considering this as one potential arm. In fact, this morning we have had discussions with the clinicians here to see whether it is something that we may want to very quickly set up our own clinical trial to look at the efficacy of this drug. So there's some level of promise, but there's quite a bit of research and clinical trials that need to be done. Of the 450 cases that we have, how many are hospitalized? I will leave that to the DG to respond. He has those figures with him. Angela, your question was regarding protocols for our athletes and sportsmen with the relaxation of these protocols in many of the other countries. I think these are matters that are continuously being looked at, because it is not only in the sporting arena, but also in the other economic activities where we know people have suffered for a long time. People need to go back and do some of their things that they do for a living, whether it is an economic activity or whether it's a sporting activity. And I am sure that there are considerations in determining what kind of measures can be put in place to begin sports, prepare our sportsmen to participate in their vocation. There will be, I think the approach we look at, one, is it our domestic sporting activities, or are we looking at allowing some of our renowned athletes to be able to participate in international meets? I think these issues are being looked at in conjunction with the sports ministry, and some form of a solution will be developed, particularly for those external meets where we want our renowned athletes to participate in. Yes, then there was a question about State House, positive cases in State House and what we are doing. I don't think I have that information with me, or I'm privy to that information to be able to discuss it here. But what I can tell you is the strategy of the ministry is to identify, trace, and treat. That is the essence of the response. So if through the testing processes a positive is identified, it follows that there must be contact tracing of that positive case, because that's the only way you can follow the transmission chain and bring it to a stop. So that continues. Anybody who's positive, whether if you are in State House, or you are in the discipline forces, or you are in any other place, you are in Parliament, the process will proceed, and contact tracing will proceed. I cannot comment on the issue of State House comptroller, and mentioned something about being hospitalized. I can't comment on that because I do not have that information.